So we're going to demonstrate application of the SWIFT technique, which is microwave technology. It's designed to provide immunity to the patient. So essentially, multiple treatments to each lesion, 5 in general, 2-second bursts at 7 watts from the SWIFT machine, and I'll demonstrate how that works. If you have comments or questions about this, go ahead and post them, and subscribe and hit the like button if you would, so we can get the word out how effective the SWIFT treatment is. The average generally is 3 treatments. This is a more complicated patient. He has a lot of lesions, and he's on his 3rd treatment right now. We're seeing some improvement, but not completely resolved yet. But when you have so many lesions like this, excision through surgery is pretty traumatic, and it's generally not necessary. So here we go. So we'll start with 7 watts, and we'll treat basically every lesion, 2-second bursts, and we'll do it 5 times for each lesion. So we're going to start here on this 4th toe, where he has a pretty sizable arcade of flat warts. This was pretty exposed. So we'll touch the button. We usually ask the patient to breathe, and it's a 2-second burst. That's what it sounds like. That's the first one. The applicator is relatively small, so we'll want to touch the entirety of each lesion with the applicator. It's essentially one treatment in 2 different locations. So I'm going to treat the bottom and the top of this one. This is a 2nd treatment in that lower spot. This is the 2nd treatment in the upper spot. And a lot of times you can see a change in the lesion. It starts to turn a little peloric or whitish. And that's usually a good sign that we're actually zapping the lesion really well. Keep breathing. So I'll give the patient a break here. That's 3 treatments in the 2 different areas of this lesion. Breathe out, 2 seconds. Attaboy. That's number 4 there. Number 4 on the upper portion. Of course, the toe hurts more because it's a lot more sensitive than maybe doing an area in the arch. And this would be essentially the last treatment here. We may come back to this one. Breathe, breathe, breathe. Great. Breathe, 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 breathe. Okay, so we've essentially treated this one. The top and the bottom amount to about what the circumference of the applicator tip is. So we did both areas, but this is essentially a group of warts that coalesce to make one larger wart. So we'll continue to this great toe area, which is about the size of the applicator tip. We're going to go again. Generally, the patients start to feel a little bit after the 2nd treatment. We try to get them to breathe in and breathe out. The 2nd part of the ramp up. Breathe out, breathe out, breathe out, breathe out. Yeah, so there's a little bit of discomfort there. We'll give them a break. Number 4. Breathe out. There you go. Of course, the toes are always more sensitive. Last one. Breathe, 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 breathe. Great. Okay, so if you're interested in this, you can visit our website, wartsnomore.net, and you can get more information on our before and after experiences with patients and videos, as well as how to contact us if you'd like more information. Thank you.